Bug just flew on me. That wasn't even planned. What's up, guys? So the adhesion release opportunity isn't something that you're weighing against other techniques and treatments and things you might want to do. It's not something like I want to try this, or maybe active release technique, or AKT, or some other myofascial release. Adhesion is a pathology in itself that causes a massive amount of chronic pain. When you specialize in just fixing adhesion, it allows you to start getting permanent pain relief results pretty immediately with your clients or your patients that you see, because all of a sudden you're starting to feel this tissue pull and tear in a way that you've never felt before. And that starts to allow you to get results where all of a sudden, maybe you've been massaging somebody, or you've been adjusting them, or you've been doing strengthening exercises, and they're like, Jane, Bob, whatever your name is, well, I feel like I'm 20% better, and it's been a week since you saw me last, and usually my relief only lasts 48 hours. Like, what the heck? And then you'll be like, oh my God, there must be something to this crazy fucking Dr. Chris, who's always talking about this adhesion stuff being a big deal, and I just was never able to feel it before. And when you realize that you can start getting one individual better with their low back symptoms, and then you start learning how to feel the nerve roots medial to the psoas in front of the spine, or the femoral nerve under the inguinal ligament, or the ilioinguinal nerve over the inguinal ligament, or the sciatic nerve, the superio-gluteal nerves at the iliac crest, and you start to feel the biceps femoris and the short-headed biceps femoris and the hamstring, and you're like, oh my God, I'm feeling this stuff pull tight. It's making sustained range of motion changes. Oh my God, this person is saying that they're more flexible than they were from 5 years ago or 10 years ago. You realize that the adhesion release opportunity isn't something you can compare with one of these techniques that's not getting these types of results. We have patients who, just today, we had another woman drive from somewhere in New York City. She's had like 10 years being disabled off of work with chronic headaches. I saw her a week ago. She had one headache in the past week. She hasn't had a day without a headache in years. And I'm treating inside her jaw and her pterygoids, and she's screaming, and she's like, oh, the patient's gonna run away. I said, let him run away. This is fucking good. You need this. And after, she's like, oh, I can open my jaw. Oh my God. And then we do the suboccipital test, and she's like, oh, I'm not feeling the tension underneath my neck anymore. What the heck? I'm like, yeah, you have a lot of adhesion in there, and nobody's tried to treat it before or fix it. Isn't this awesome? The adhesion release opportunity is something that stands in and of itself. We teach you how to feel the adhesion. We teach you how to feel it lengthening. We teach you how to tear it for every individual muscle and every muscle nerve intersection of where this stuff gets stuck, so that you can start to get sustained results and be really confident in your skill set and your ability to deliver results to people. So then you can choose and pick patients. And when patients come in and you do an exam and they don't have any adhesion, you can confidently tell them, I can't help you. And guess what? They trust you even more. And we've had patients that we get referred from those people, even though we've never even helped them, because they trusted us, because they know that we're only going to take on the patients who we know we can help. And given we have an 80% success rate, but we discharge most of those patients within 5 visits or less, so people know what to expect. So we're not going to waste our time, energy, and money in trying something that they wouldn't have had the answers with if they just knew what the problem was. I'm mumbling at this point, but you get it. The adhesion release opportunity stands in and of itself. It's not something to compare to ART or AKT. You have to know what you want when you're getting those techniques. When you're getting this technique, you're learning how to fix chronic pains non-surgically that nobody else has been able to fix, and be able to help those people because you want to develop a skill set and invest your energy, time, and money in getting better at this stuff. So if you want that, DM us beta and let's see if you qualify for this. So 2023 could be the best year in practice that you've ever had. I love you. Boop. Chris signing off.